Dermatologist Dr. Barankin joins us to virtually educate us on the latest information when it comes to both facial and body acne in teens. Good morning, doctor. How are you?
Very well. Good morning.
Good morning. Thanks for joining us. So first of all, we go back to a lot of us having acne as teens and, feeling a little self-conscious. Do all teens get some level of acne?
That's a great question. About 80% of teenagers and young adults between the ages of 20 and 40 get acne, so very common.
So I know, we often hear back when you're a teenager that, you got to watch your diet, don't eat junk food, but we also know it's hormonal. So what's the balance there? How much of it is it hormone-based and how much is it diet?
Certainly in female patients, hormones play a much larger role. Diet seems to play some bit of a role in some patients. So we know that high glycemic diets seem to aggravate acne in some patients. Dairy, in particular skim milk, may also aggravate acne. And other patients have found other foods that seem to aggravate it for them.
So when, at what stage does somebody decide, I need to go to a dermatologist? Like how far? I think people probably have different levels, but, because it could, as you say, it can go all over your entire body, right? Down your back and, on your chest. So where do they finally call you?
Sure. I think it's reasonable to try a number of things that you can buy at the pharmacy. There's a variety of products, face washes, and leave-on products that have things like salicylic acid or benzoyl peroxide. I would say if the acne is leaving marks or scars, if it's affecting your mood or how you dress, if the over-the-counter products are not doing the trick, or there's a family history of severe acne, or it's affecting you psychologically, I think those are all good reasons to see your physician, your dermatologist. Yeah.
Again, we talk about the self-conscious part, right? And also acne scarring, right? And, I'm sure you're recommending to patients to not pick and not squeeze and leave it alone so that you're not dealing with the aftermath when you're in your 40s and 50s and beyond.
That's right. I mean, I think the main point that I try to tell our patients is that, we want to treat your acne so that you look good, you feel good, and most importantly, that you don't scar. And certainly picking and playing and squeezing your acne does not help it at all. And, to treat acne scarring is not easy. It can be expensive. It can be painful in some cases. So it's really something that we want to prevent through good active treatment and prevention.
So let's talk a little bit about from treatment from your standpoint. I remember years ago, Accutane was around, but where are we at right now in Canada with treatment?
We have a lot of great treatment options. So obviously we have a few over-the-counter options that are worth starting with. Then we have the prescription creams and gels, and we've gotten better topical therapy than we've ever had before, including a new acne therapy that's the first approved for both acne on the face and on the trunk. So that's very exciting. And then we have pill options, and those usually include things like antibiotics, hormonal therapy like the birth control pill or spironolactone, and then, as you mentioned, Accutane. And then there are the treatment options as far as chemical peels and lasers.
So there are a lot of options for people. They don't need to be having to deal with this on their own, and getting just a little bit of help and just even advice and a conversation with someone like yourself can really help them get through these tough years.
Yeah, absolutely. Yeah, it's not something that you need to suffer through. We used to say it's a rite of passage, but it really, it's not something that, you need to let it go just because, many people do outgrow it to some degree. I think it's something we want to treat. We want you looking good, feeling good. We want to prevent scarring. We want you just to be your best and look your best.
Right, exactly. We already know it's tough enough being a teenager, right? So Dr. Barankin, thank you so much from the Toronto Dermatology Centre. We really appreciate you coming on the show.
Nice chatting with you.
All right, thank you. That's it for now. We have a quick break. We'll be right back.